Hi everybody, thanks for joining me at Newsdesk this week. I know that you're aware that we're doing lots of strategic planning. All of the programs are involved in this at the moment. And one of the wonderful things that's happened from our planning group is that they have developed an environmental scan for UHN to help us to think about where we're going and in particular about what's going on around us. And I thought it would be very important to share some of this with you because it is very, very rich and very interesting. And this is a macro environmental scan to develop assumptions for strategic planning, but also, of course, things that you will need to know about what's going on in the world around us. So first of all, political trends. The World Health Organization's focus is on primary care. And of course, we know that that's the greatest asset in terms of improving health overall. Other political trends identified are climate change, concerns regarding health care costs, advancing quality in England where hospitals are paid bonuses for best quality care, health care reform in the US where there's a move to increase the percentage of insured individuals and create a public system competitive with a private system. There's increased consolidation of services in US, and the public versus public-private mix debate is on in Canada and remains an issue. And Ontario is the leader in system accountability and wait times, and I can tell you also that Ontario was recently identified as having the highest quality at the lowest cost of all provinces in Canada, so we can be very proud of that. Economic trends. Global health spending is growing faster than the gross domestic product across the world, 35% increase from 2000 to 2005. In US, the top performing facilities are thought to be most efficient, Mayo Clinic, Cleveland Clinic, Intermountain Health, and their reason for that is their attention to value for care. And you may have heard my presentation about that, and if not, please take a look. Continued environment of fiscal constraint around the world, decreased access to capital dollars, witness our delayed Mars development. Asia-Pacific healthcare sector is rapidly expanding and a concentration of bottom of the pyramid growth. So GE, for example, looking at those lower cost activities addressing an increasing middle class. And Canada's healthcare spending, 6.4% growth to $171.9 billion between 08 and 09. And uncertainty around inflation assumptions for 2010, 11, and 11, 12. And we know that things are not getting better in that economic forecast. Social trends of interest to you. Knowledge and access to information is increasing rapidly, and patient empowerment is a crucial focus in the next 5 years. The Danish system provides access to care as well as access to information. Expectations around methods of communication are evolving, and we of course know of all of the social media tools that are being now utilized and many others. Receptiveness to innovation, a willingness to explore new methods of care is present. Medical tourism is alive and well. Self-care is definitely on the rise as an interest of consumers, and online advice, such as MyChart, Health Vault, etc., have been developed as alternatives around an electronic health record. Delayed retirement is alive and well, and growing prevalence of mental illness is noted. Demographic trends, increasing multiculturalism, globalization, health equity is a big issue, access issues for immigrant communities in Toronto in particular, urbanization from 38% to 50% of the population in urban areas in 30 years. Aging population and workforce combined with unhealthy lifestyles, increasing multimodality, multimorbidity diseases, and infectious disease. Technological trends of interest. Global IT sector is slowing due to the recession. Trend toward more pervasive, cost-effective technology versus high-tech. IT is a driving force of efficiency in healthcare, And new technologies, minimally invasive technology, cardiac and neuro devices, combined diagnostic and therapeutic devices, nano devices, biological materials, genetically engineered vaccinations. And the cost of technology is 20 to 40% of annual rise in health spending in the U.S. since 1960, just amazing. And increased cost per unit cost of care, as well as increased ability to treat new patients. Changing consumer values, the patient experience top a priority, more prevalent consumer style expectations, higher expectation of good governance and high performance, decreased environment footprint, access to information and access to digital care, point of care increasingly important to consumers, and willingness to accept new scope of practice and providers. And lastly, trends undermining health systems include a lack of expertise to adjust to this new environment, hospital centrism, important for us to pay attention to, fragmentation of services, commercialization in unregulated health systems. Access, a big issue, increased private clinics, lower access than counterparts in other developed countries. Funding, decreased research funding in particular, and health status. Since the 90s, we have dropped from 5th to 10th place out of 16 developed countries. So those are some interesting trends that you need to pay attention to. That's it for today. Talk to you later. Bye-bye.